Mr. DeSaulnier, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, nice to see you, the pride of McClatchy High School. I want to talk to you about kids' mental health. What the Surgeon General has said, what the American Psychology and Psychiatric Association has said, the urgency, and as fellow Californians who are well aware of the benefits of social media and technology, but also the challenges, particularly around young people. Surgeon General said that a third of young girls in this country, American girls, have contemplated suicide. 10% of young people in the United States have attempted suicide. So we know this connection now. The amazing investments we've made in behavioral health, and when you look at Johns Hopkins, UCSF, Stanford, your alma mater. I was just there 2 weeks ago to visit their Center for Youth Mental Health and Social Media. These connections, my own view is the private sector is using what we've learned from neuroscience, particularly in cognitive development, to addict young people. And it goes right to some of the more unpleasant parts of human nature. So can you talk a little bit about what we can do to get on top of this? We're losing a generation, according to the Surgeon General and the professionals, about how young people are spending 3.5 hours a day on social media and media. We know what they're doing. We know with these amazing investments, we've probably learned more than in the last 50 years on cognitive development because of imaging and the investments at NIH and NI Behavioral Health on how this is affecting people. But it's frustrating to see what's happening literally every day in this country. What can we do to partner with you? And it should, in my view, and Madam Chair, we've had these discussions, this should be a nonpartisan issue of great urgency, is to putting some guardrails on innovation, quote unquote, to make sure that we're doing no harm to future generations of Americans.
Yeah. And Congressman, as you know, technology is outpacing our ability to keep up with it. And so once we come up with a way to try to help these children survive and improve their mental health status, something else comes up that's new in social media and so forth. And so it becomes very difficult. We are trying to partner with many of the institutions and agencies that are trying to help kids to try to improve opportunities to get to them before social media takes them on the wrong path. We're, for example, trying to do far more mental health in our schools. And we're encouraging school districts to work with us to see if they can qualify to get Medicaid dollars directly so they can provide behavioral health services at their school sites for kids. And so we'll try to do what we can to expand access to health care. But I will tell you, one of the most important things we can do is finally treat mental health on parity with physical health, because we still have insurers who are not reimbursing for mental health services when they would reimburse for other physical health services. So we have to do more to really put mental health on par with physical health.
I appreciate that. The sense of urgency, that word, I think is imperative. I look forward to working with you. On a different subject, as a survivor of cancer with a form of leukemia that is chronic, but I was just told, again, it's your alma mater. I don't spend a lot of time on the peninsula, but I did. It's some of the work they're doing now. They now think, again, because of public investment, that you can cure what historically my form of leukemia is chronic. So I was asked to go speak to the head of UCSF's cancer program, who spent years running London's cancer programs. He talked about the difference in the cultures. He wanted to talk to me in frustration about all the amazing diagnoses and treatments they have, but the disparity that they can't get. He told me with quite a lot of passion, there are people within an hour of this institution that I can save their lives, but they can't access that treatment. What can we do on disparity specifically in cancer? And then secondarily, I just want to mention the drug that keeps me alive in my pocket. When I started taking it was $500 a day. It's now less than 100, but it's still in Australia, it's a little over $25 a day. And executives, when I ask them, they say that's part of our business model. Americans pay to subsidize lower care. So in the 30 seconds we have left, could you talk a little bit about the disparities?
Just generally, this is what happens when you treat healthcare as a commodity, that you game the price. And it's a matter of whether you can afford the price, not whether you can get the healthcare you need. That's got to change. But also we have to do more to make sure that we're reaching people at the beginning. Cancer screenings went down. Some 9 million Americans missed their health screening during COVID. We need to get back to doing the basics of prevention so we can try to keep people from ever catching cancer.
Thank you, Mr.